Hello, everyone. It's Thursday, December the 16th. Again, regretfully, we've lost 28 more West Virginians. It's surely better than 100, but at the same time, it's terrible. 28 great West Virginians. So join me in prayer for these people, please. The 5,115th death in West Virginia is an 89-year-old female from Cabell County. The 5,116th death, a 61-year-old female from Cabell County. The 5,117th death, a 67-year-old female from Jackson County. The 5,118th death, a 64-year-old male from Greenbrier County. The 5,119th death, a 79-year-old male from Greenbrier County. The 5,120th death, an 83-year-old male from Monongalia County. The 5,121st death, a 91-year-old male from Mineral County. The 5,122nd death, a 77-year-old male from Monongalia County. The 5,123rd death, a 61-year-old female from Raleigh County. The 5,124th death, a 36-year-old male from Mineral County. Let me do that again. The 5,124th death, a 36-year-old male from Mineral County. It's really sad. 5,125th death, a 72-year-old male from Marshall County. 5,126th death, a 59-year-old male from Mason County. The 5,127th death, an 83-year-old male from Berkeley County. The 5,128th death, a 76-year-old female from Jefferson County. The 5,129th death, a 77-year-old female from Raleigh County. The 5,130th death, a 77-year-old male from Harrison County. The 5,131st death, a 61-year-old female from Harrison County. The 5,132nd death, a 64-year-old male from Kanawha County. The 5,133rd death, a 71-year-old male from Jackson County. The 5,134th death, a 52-year-old male from Brooke County. The 5,135th death, a 57-year-old male from Cabell County. The 5,136th death, a 70-year-old male from Kanawha County. The 5,137th death, a 56-year-old male from Taylor County. The 5,138th death, a 69-year-old female from Marion County. The 5,139th death, a 45-year-old male from Raleigh County. The 5,140th death, a 59-year-old male from Harrison County. The 5,141st death, a 56-year-old male from Marion County. The 5,142nd death in West Virginia is a 74-year-old male from Nicholas County. Please keep each and every one of these folks in your prayers. You know, I read to you the tragedy of every young person that we've lost, and I pause and everything because I just think, for crying out loud, you know, my kids that age they're in between the ages of my children, and I still think of them as little teeny kids. They're grown up now. You know, absolutely, this thing has really been tough, and tough on lots and lots of people. Don't let them become a number. That's all there is to it. Don't let these people become a number. Active cases are 8,737 now. We have 1,279 new positive cases. Daily positivity rate at 8.45. Cumulative rate at 6.34. Recovered cases just barely under 300,000. 629 that are now hospitalized. 201 in the ICU units and 120 on ventilators. You know, what I've told you over and over about the percentage of unvaccinated in our hospitals and ICU units continues to grow, meaning more and more and more of the percentage of the folks that are there are unvaccinated. Without any question, the vaccines work. With 2 green counties, 14 red counties, 20 outbreaks in our school communities in 15 counties, 238 cases. I remind you about being 65. I can't say it enough, but if you've got any symptom at all, you got to get checked, because as quickly as we possibly can, we can get you the antibodies, and the antibodies will save your life if we can catch this early enough. I encourage you, if you're going into a crowd of people, to wear a face covering if you're 65 and older and you have absolutely any kind of health condition, heart, lungs, whatever it may be, diabetes and everything. You really need to take extra precaution. You know, the boosters are the key right now in so many ways. We have so many people that are vaccinated, and we're getting there as far as the number of people that are getting their booster shot. But if you're not getting your booster shot and you're fully vaccinated, I don't get it. I don't get how in the world you could have made the decision to get vaccinated, and you must just not know. You must just not know that if you're 6 months out, getting that first shot isn't doing you much good at all. You have got to get that booster shot right now. Oh, the Pfizer study tells us good stuff, that it gives you a 25-fold increase in fighting off this virus and everything. So I don't know how much more information you're going to have, but you've got to get that booster shot. All the numbers are, we're 82.5% of the 50 and olders that have gotten one shot. There's 90.3% of the 65 and olders have gotten one shot. 70% of the 18 and over have gotten one shot. You know, we're getting there. We're getting there, but it has been an absolute struggle. 63.9%, 64% of the 5 and older have gotten one shot. Absolutely nobody in their right mind could deny that all the stuff we've done, all the baby dog stuff, all the preaching, all the extra briefings, all the stuff we're done works. And it's worked and worked and worked. These great experts, you know, Dr. Marsh, General Hoyer, Dr. Amjad, you know, Secretary Crouch, all the people that have come on and given testimonies, it has absolutely worked. It just needs to be faster. That's all there is to it. Okay, we're going to, can I announce where we're going to be tomorrow? Okay, our grand prize, you know, on our Do It for Baby Dog round 3, $100,000 check and a party for the students has been awarded to Matewan Grade School in Mingo County. And they were drawn out of a hat, and we congratulate them, and we'll be there tomorrow. And I hope we'll have a great big crowd, a lot of folks that'll come and everything, and celebrate that happening right there at Matewan Grade School. I mean, you know, that's really good. Great stuff. We'll, you know, the last week we're giving away all these prizes, these $10,000 education funds. We've got a grand prize, and I guess we'll announce that tomorrow, you know, that at Matewan, you know, to the students that won. Is that correct? And in addition to that and everything, Baby Dog will be there, and who knows, Santa may even show up. And so, good stuff, great stuff. The other thing we're doing, this Do It for Baby Dog Senior Center Edition, where we're going to target our seniors in a bigger way and go to our seniors. We're going, you know, all of our seniors that have been fully vaccinated and have their booster will receive a $50, you know, prepaid, I guess, Visa gift card. And in addition to that, we're going to give the top 4 senior centers a $100,000 prize, you know, for doing great work and getting people vaccinated and everything. And so we're going to be doing that. I guess we're going to start on that real soon, and the application process is going on right now, and the deadline will be December the 27th. So you need to get with it and apply, and we'll try to take care of y'all too and everything. We'll try to encourage more and more seniors to get across the finish line. Now, you know, I just got a note that Clay has an announcement on the Omicron virus. Is that correct? You know, do you want to do that now? Okay, you know, Dr. Marsh, if you could come on and give that, and then I'll finish up.
Thank you, Governor. Just to let you and everyone else know that we just immediately received notification from the Centers for Disease Control that in their surveillance study of West Virginia, that they have now identified a single case of the Omicron variant in West Virginia. And we know that the Omicron has been here, is now starting to grow in West Virginia like other places. But we just wanted to make sure, as we just immediately got that information, that we shared that immediately with the audience. So back to you, Governor.
Okay, thank you, Dr. Marsh. And it's not good news, but we knew it was coming, did we not? I mean, it's running across this entire country. In fact, it's running across the whole globe. So we knew it was coming. Well, how do we stop it? What do we do? I just read to you, Pfizer said that booster shot with Pfizer gives you a 25-fold protection against this virus. You know, how do we stop it, West Virginia? We got to get you across the finish line. I tell you over and over and over, I don't care what you're doing. I don't care what you're doing today. You know, there is nothing more important than getting your booster shot. Nothing. Nothing. Absolutely, you should get back, you know, your regular vaccines, but there's nothing more important than that booster shot right now. Absolutely, it'll save your life. It'll save a lot of tragedy. You got to go get the booster shot. Young people, you know, 5 through 35, we really appreciate the help that parents and grandparents have given us, because we've got a lot of kids, a lot of kids that have been vaccinated and continue to get vaccinated. All the information's up on our COVID vaccine line there. You know, as far as the free testing, take advantage. I mean, as far as Frith and Walgreens, we thank you over and over. We've got 44 outbreaks in our long-term care facilities, none in our church community, 139 inmate cases and 34 staff cases. Corrections still is doing a great job. You know, I remind you about getting your flu vaccine, and I remind all the people out there that as far as the renters or landlords, you know, please take advantage of this program that we have. We've got dollars there. All you've got to do is get in touch with us, and we'll see if we can get you qualified and everything, and we can send you some money that we've gotten allocated from the federal government. The last thing I want to say is just this, that we just got through doing a press conference here, and you know, the President of the Senate, Craig Blair, joined us, and the Speaker of the House, Roger Hanshaw, joined us and everything, and we're basically arm in arm with doing something really special for our state employees. We're going to do another 5% pay raise, unprecedented, historic beyond belief and everything. We've got the money to do that. And absolutely, these people have stood up and kept our government running and run to the fire in lots of different ways. We've had our teachers in the classroom with our kids and everything, and been able to keep our schools open. There's been so much good that have happened. There's a lot of great work that these people have done, and we want to try to help them while we can help, and at the same time we want to continue to try to absolutely do everything we possibly can to mind the store in a good way. We've done it with almost a flat budget for a long time, for the whole time I've been here just about, and with all that being said, without any question, our state is really doing well. We want to reward our people and everything. And the other thing we've done is we know this. We know that coming out of D.C., what we got now is we've got grocery prices higher. We've got gasoline prices higher, on and on and on. You know, without any question, we're having to deal with inflation. So we're, in addition to doing this, we're doing a one-time 2.5% bonus that is basically an inflation vaccine that we're going to call an inflatocene. An inflatocene of 2.5%. It's a one-time deal that we're going to go to our state employees to be able to help them through this tough time and combat this situation. We're doing everything we possibly can do across West Virginia to help all of our people. We want to do that first and foremost. I thank President Blair. I thank the Speaker of the House, Roger Hanshaw. I thank the House and the Senate for standing strong with us in moving forward. We've got to get this passed. This will come up in the session that's just weeks away from us. This will come up in my State of the State address, and I will put it forward for them to vote on it and everything. And I feel very encouraged that this will pass overwhelmingly and it'll pass very quickly. And then we can absolutely, if we can find a mechanism, we'll get the bonus check out, the inflatocene check out. We'll get that out immediately, following the passage, and then fall right behind that with that 5% pay raise. But the other thing we got to do, we got to continue to create opportunity and job growth and competition for employees that gives us higher wages and all those good things that are going on within our state right now. So at the end of the day, our state moves forward and moves in a great way, and that's what we need to do. We've changed our image. We've made West Virginia the diamond in the rough that everybody missed. We absolutely are away from trying to compete with Mississippi on who's going to be dead last in the country. Without any question, we're on our way, West Virginia, but there's lots more we can do, and there's lots more we can help, and that's what we want to do. We want to continue to flip every rock and help every single person in this state in every way we can. So with that, that's all I got right now, and I'll pass to others.
All right, thank you, Governor. We'll go back to Dr. Clay Marsh now, our coronavirus czar.
Well, good morning. And as was mentioned earlier, we now also join the ranks of almost 2/3 of the states in the country who have been impacted by another variant of COVID-19, the Omicron variant. And I'd like to focus my comments on our two main missions here. Number one is to save lives and to maintain health. And number two is to maintain the capacity of our hospital systems so that people with not only COVID-19, but also people with other acute medical illnesses and chronic medical illnesses get the care that they need. And as we look at the rest of the country, and now let's look right around West Virginia, our border states. Let's look at Ohio and Pennsylvania and Maryland, and we see hospital numbers are going up to near historic levels. In Maryland, they have doubled their hospitalizations in 1 month. And those doublings and the increase that they are seeing from COVID-19 is not from the Omicron variant, it's from the Delta variant. And we know that unvaccinated people or people who are eligible for boosters who have not gotten boosted are driving this new surge in COVID-19 cases that is starting to overwhelm hospitals. And as we've talked about, on September 24th, we had 1,012 people in our hospitals in West Virginia. And today we have, I believe, 623. So we have not been able to create a large reserve like we had before. And we know that with the number of unvaccinated people in West Virginia, the number of only singly vaccinated people in West Virginia, and the number of people that are booster eligible that have not been boosted, we are at great risk as well to lose lives, as the governor reads every day, but also to overwhelm our hospitals. And let's talk just for a second about the Omicron variant, which is coming now and growing in West Virginia as we speak. In the United States, on December 4th, the Omicron variant was 0.4% of all cases. In 1 week, Omicron became 2.9%. That's what it is currently, 2.9% of all cases. In the United Kingdom, the number of Omicron cases is doubling every 1.5 to 2 days, which is remarkably faster than the Delta variant. And it's been estimated that the Omicron variant is about 3 times as infectious as the Delta variant. There are reports from South Africa that there may be some reduced individual level of severity from Omicron, but this is really needs to be interpreted, understanding that South Africa has a young population, that Delta variant had been infecting actively a number of these people before Omicron. So there was and is immune protection from native immunity in that population. And about 1/4 of that population is fully vaccinated. We know that having vaccine in you, being fully vaccinated, does give you protection from Omicron, but only at about a 73% rate as opposed to a 90-some% rate. And that's the reason why boosting is so important in people who are eligible for boost. We also know, as we talked about last press brief, that 3/4 of all Americans who've died of COVID-19 have been over 65. And that equates to 1 out of every 100 over 65-year-old American since the pandemic has begun has died of, has been among the 800,000, has been over 65, 1 out of 100 deaths. And so we know that it's really important for people that are older, and West Virginia is the third oldest state, and people that are vulnerable, immunocompromised, to please get boosted or get vaccinated and get boosted, because ultimately, even a milder individual case of COVID-19, and we don't know if that translates, but let's just argue it might, can still cause the death of people that are older and immunocompromised with other medical illnesses, just like we see from the flu every year. So it's a very critical time for West Virginia and for our country. We are seeing surges in hospitals all over the country, but now importantly, we're seeing surges in Ohio, Pennsylvania, Maryland, and we know that those states join us. And we also know that we have the most vulnerable population by the Kaiser families going into this. So it is now time for all West Virginians to run to the fire, pull the rope in the same direction, get fully vaccinated if you haven't yet. And if you have been vaccinated and you are eligible for a booster, please get a booster, because less than 50% of our over 65-year-old population has been boosted. Less than 40% or around 40% of our over 50-year-old population has been boosted, and just over 30% of our 18-year-old and above group who's eligible for a booster has been boosted. We need to improve those numbers. We need to do all we can to protect the capacity of our hospital systems and to save lives in West Virginia. And that would be the greatest gift this holiday season could bring if all West Virginians answer this call. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Yeah, just to reinforce a couple of points made by both the governor and Dr. Marsh with the Omicron variant now detected in our state. Our hospital numbers did not take a significant increase today, but they still are above 600. So we are still managing those challenges. And as the governor's pointed out before, large percentage of those individuals to include 87% of our ICU patients and 85% of our ventilator patients are unvaccinated West Virginians. So we must continue to get West Virginians vaccinated, and we must continue, as Dr. Marsh pointed out, to get West Virginians boosted. We have plenty of vaccines available, that treatment, but we continue to see a national supply chain challenge in antibodies, and we think we will see a similar thing as they approve the Pfizer therapeutic, that will be available, but not in large quantities. So West Virginia, again, we need you to get vaccinated. And as the governor pointed out, we are starting to see West Virginians listening to our messaging and to take advantage of the opportunities that we have given them with the various events that have gone on, as now over 70% of the population over 18 have taken at least one dose. But we've got to get that number into the 80s to have success. Thank you.
Thank you, sir. Dr. Ainamjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from David Beard with the Dominion Post.
Hi. My question would probably be for Dr. Marsh, and part of it's been answered before, but I've been asked about it again. So if we could use a reminder. How do we determine whether a particular infection is Alpha or Delta or Omicron? And when you do the sampling, how do you project the total to say 90% of it's Omicron or 90% of it's Delta? And the third part of the question is, you mentioned that the CDC told us we have a confirmed Omicron case. How is it that the CDC tells us what we have and we don't know first? Thanks.
Dr. Marsh, please.
Thank you, Governor, and thank you, David. So the CDC has a surveillance system that they work with companies like LabCorp that also does some testing in West Virginia as well as other states. LabCorp sequences using next generation sequencing to be able to identify specifically which of the variants forms of COVID-19 is that positive PCR test. So you have to have a PCR test be done, which is the genetic test for COVID-19. And then the positive genetic tests are sequenced largely in our state laboratory, but also smaller numbers go through LabCorp and other vendors that do testing. This positive case, this Omicron case, was identified by one of the private groups and reported back to the CDC as they did their genetic sequencing on the virus. And we are in West Virginia are working with, with the state and with Q Labs, which is another company in Charleston that does a lot of great work for West Virginia. And we are sequencing as many of the positive result PCR tests that we can identify. And they're shipped up to Morgantown and now some in Marshall. And the collaboration between the two universities with the state that sequences all of these positive tests and identifies whether these tests are Delta variant cases, Alpha variant cases, Beta variant cases, or now Omicron variant cases. And the last run that we did in the state, which was last week, we had 100% Delta variant cases. We are doing another run this week in the in-state laboratory, and we are confident that very soon we will also start to see the Omicron variant in those samples. So it's really a matter of the surveillance system the CDC uses with LabCorp and other vendors, not just in West Virginia, but around the country. But the majority of the samples are sequenced by our in-state group, and our in-state group has not identified an Omicron variant case yet.
All right, thank you, David. Next, we'll go to John Mark Shaver with West Virginia News.
Good morning, everybody. I have two questions for you. Number one, for Governor Justice, with the announcement you made earlier this morning on the 5% pay raise, where do you plan to get that money from, and how much do you think that will be for all state employees? And my second question, probably for Dr. Marsh, is with the Omicron variant here, does that change how people should approach holiday gatherings and their strategies surrounding that? Thank you.
Well, let me take the first part, and then Dr. Marsh, I guess you got to back up here and everything, but the total dollars that this is going to cost, inclusive of the inflatocene bonus of the 2.5%, will probably fall right in the neighborhood of $160 million. It, as far as the 5% pay raise, inclusive of the pension liability to the 5% pay raise and everything, will probably be somewhere in the neighborhood between 100 and 120 million. I kind of hit it on the high side, from the standpoint of the 170. It may come in really at 150 total, but the net of the whole thing is just this. The state of West Virginia today has a significant surplus today, and it's going to continue to get more and more and more of a surplus, we think, at the end of this month. We absolutely want, going forward, to not labor our state. That's why we did a 5% raise, and we did not include the inflation vaccine, the 2.5%. That's a one-time hit and everything. But we're going to work all the different buckets to make all this become a reality and everything. And West Virginia really needs to reward these people and step up like I'm talking about and everything. And I'm really happy to see the Senate and the House right with me in regard to that. But with that, we'll work all the different buckets and we'll make it happen. Today we're doing really, really good. We continue to do good. We've done good the last few years, and we're going to continue to do good. And we're going to stay on this glide path and everything. And I hope and pray we'll stay here and get better and better and better for decades to come.
All right, Dr. Marsh, we'll go to you now.
Thank you. Thank you for the question. So I think that we should be very cognizant of the issue of maintaining our own health, but also, protecting our community and our families, and particularly our elders and people who may be susceptible to getting sick with COVID-19. And I think that really translates to saying that if you're with your immediate family, of course, those are the people you live with, so that would be fine. If you're going to host other people or to go to gatherings where there are vulnerable people, either people unvaccinated, people older, immunocompromised, partially vaccinated, not boosted, then I would take extra care. And I might suggest that people in the party consider doing a rapid test, antigen test, particularly if anybody has any symptoms. Although we're learning more and more that children may well have COVID-19 with this Omicron variant and even maybe other variants and be relatively less symptomatic. So testing those who may be attending who could pass COVID to more vulnerable people might be a good idea. Certainly, if there are people that are vulnerable, then making sure that you're taking appropriate precautions and perhaps even considering visiting virtually or using masks or other kind of mitigation measures might be helpful as well. But this is really just another reminder, given what we're seeing today in the country around us, also with our reproductive rate going up and us worried about the new variant coming. It's a real important time for all West Virginians to be really careful and thoughtful. And the most single important thing that everybody can do is please get fully vaccinated, or if you're eligible for a booster, get a booster. That is the best way that we can guarantee the safety and the capacity of our hospital systems for the whole, and the safety and well-being for the individual. Thank you.
All right, thank you, John Mark. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Good afternoon, Governor and panel. I would like to ask more questions about the Omicron case. So yeah, do we know if this is a single case or a few cases, and what part of the state did this case appear? And can we even get information on if this person was vaccinated or symptomatic? And then, yeah, just any insight you can give us on the trajectory of the Omicron variant that you think it will have in West Virginia. If we've got one case now, at what point will that variant make up 10% of our cases or 50% of our cases? Thank you.
Let's lead off, General. Maybe would you like to answer some of this, and then maybe we defer to our doctors?
Yes, sir, Governor. So June, as Dr. Marsh pointed out, it came from CDC surveillance, which is different than what we do.
Looks like we're having a connection issue. Oh, we got him back now. General Hoyer, if you don't mind repeating your answer there, we lost you for a second.
Yes. So June, we received that from CDC data from their surveillance system. We just received it about 20 minutes before we started the press conference, so we're still pulling data together as to the specific information on that. Once that is made available, we will provide more data. But if you go back to Dr. Marsh's point early on, what we're seeing in the United Kingdom is a doubling every 1 and a half days of Omicron cases, then certainly we will see a significant increase in Omicron cases here in the near future. Governor, I'll turn it over to the rest of the group.
John, go talk to us.
I'm sorry, Governor, who do you want to talk?
Well, I said Dr. Amjad because she hadn't.
Okay, great.
Oh, yes, Governor. Sorry, we're in the building with bad Wi-Fi. Well, yes, June, what General Hoyer said, we're going to get that information as soon as possible. We really just received it, but we wanted everyone to be aware of that so that they can take extra precautions. But we'll get that information out as soon as we have that from our epidemiology team, who's going to look into which county, who's infected, the breakthrough case, all the questions that you asked. But we just don't have it right now. We did get it just literally right before we started. Thanks.
And Dr. Marsh, have you got anything else?
Thank you, Governor, and thank you, June. The only thing that I would say is that we have never experienced a form of COVID-19 that can spread as rapidly as the Omicron variant. And the Omicron variant is a bit different than Delta in that it appears to be about twice as infectious inside of families and about 3 times as infectious overall than the Delta variant. It also seems to be able to infect people who have been either previously infected with another form of COVID-19 or people that have been vaccinated but not boosted. And so we know that there is going to be many cases of the Omicron variant that may not respect some of the same boundaries or borders or barriers that we have seen with the Delta variant. And in fact, in Denmark, with 80% of their population fully vaccinated, 3/4 of the Delta or of the Omicron cases in Denmark are in people that have been previously vaccinated. The vaccine still gives some protection against severe disease, apparently, and that's what we're seeing somewhat in South Africa. But the truth is that we need to pay particular attention because the Omicron variant is a worse form of COVID-19 than we've seen before related to its ability to spread person to person. And given our vulnerable population and given what's going on around the rest of the country, we are in the bullseye right now of a very, very large storm that could be coming right at us and at our hospitals and at our communities and at our citizens. So I know a lot of people are tired of hearing us, continue to say, you got to do this, please do that. But it is so important right now that we really protect our state before we get underwater. And that protection really involves people being actively immunized, boosted, and being very smart and testing yourself if you have any symptoms of cold or otherwise so that you don't inadvertently spread it to people that might die of COVID-19, including dying of the Omicron variant. Thank you.
All right, thank you, June. Governor, I'll turn it back to you.
Well, it's surely not great stuff to realize and have our first case of the Omicron variant in West Virginia. But we knew it was coming. It's spreading across all of our country. We're very thankful that it hadn't gotten here yet, but up until today. But, in sitting and just making notes and listening to the people like I do all the time, I got to tell you this story one more time. Dr. Marsh and I were doing a show with Mark Curtis, and it was on naturally, what was going on with COVID in the beginning days. I'll never forget this moment, and I asked you to just ask yourself this question: how smart is Dr. Marsh? How smart is he? How good is he? Let me tell you this. We got through that show, and if I remember correctly, we either had two 2 cases in West Virginia or 2 deaths. I'm not sure. I think it was 2 cases. Well, when we were through with the show, somebody came, we were walking off the set. Somebody came up to me and said, you know, Governor, we have now doubled our cases and we have 4. Now, just think about it. We had 2 cases, and now, Governor, we have 4. And Dr. Marsh overheard that and looked right at me, and he said, this thing is really going to go right now. Right now, it's really going to go. Before we know it, we'll double to 8, then 16, then 32, then 64. It's really going to go right now. Now, just think. Answer the question. How smart is Dr. Marsh? How much should we listen to these experts? How much should we absolutely depend on the General Hoyers or the Dr. Marsh or Dr. Amjad, your governor, you know, Secretary Crouch? How much should you depend on the knowledge that we have? You should really think. You should really think really, really hard about this. We need to get vaccinated. Absolutely, without any question, you need to get your booster shot. I ask you over and over to ask that question to yourself. We had 2 cases that had doubled to 4 cases. And this man looked right at me and said, Governor, this thing is going to go right now. Well, it takes intelligence, and it takes experience, and it takes insight, and it takes gut to absolutely know those things. Well, you know, I can never thank him enough, or all the others that have been right with him, the General Hoyers and Dr. Amjad, Secretary Crouch, and on and on and on, that have absolutely just helped in every way, supplying information and expertise and all the good stuff that's helped us get through this. We still got a long ways to go, and those very people are telling us over and over and over, get your booster shot, get your booster shot, get your booster shot, get vaccinated. How many times do we have to hear it? From a man that looked at me when we had 2 cases and we're going to 4 and said, this thing is going right now. Now, the only other thing I would say is just this, you know, in the last 5 years, West Virginia has made incredible progress. And I'm really proud. I am really proud. And there's been lots and lots and lots of people that have pulled the rope. We've been through this horrible pandemic, and we're still right maybe in the middle of it. Got a long ways to go. But we've accomplished all kinds of incredible stuff. And with that, we have taken care of the store, haven't we? For all practical purposes, we've done it with a flat budget. We've not increased spending in West Virginia. And absolutely, we have done it with all kinds of goodness going to all the folks of the state of West Virginia and opportunities as well. With all that and everything, as we step forward with these surpluses and everything, we're able to reward our people. But we want to be absolutely diligent in what we do, and we absolutely want to be good. We don't want to be frivolous and throw money away. We're not going to do that. We're not going to do that. We're going to take care of our people. We're going to mind the store, and we're going to continue to have more and more and more goodness in West Virginia. So I thank all of you out there that have done so much. And I have not mentioned this to my staff, and they're going to get caught a little off guard in this. And they're probably saying, oh my gosh, what's he going to say now? And everything. But here's one thing we need to do. This coming Thursday, you know, a week from today, we have several announcements that we're going to be making this coming Tuesday. And we just had to postpone it just a little bit to really bundle it all up together. We were going to tell you more and make more announcements today on the CARES money and things like that. But we'll be doing that on this coming Tuesday. And it'll be great big stuff. And then there's a little sprinkle of more even good stuff that needs to come on that Thursday. But Thursday, the day before Christmas, you know, we need to have a day of prayer. And so on that day, I'm going to direct my staff to contact, you know, the ministers and the folks and everything that can come on, via Zoom and everything, and us do just that, because it seems more fitting than anything to do at Christmas, but at the same time, we still got a ways to go with this terrible pandemic and lots of stuff that's going on in West Virginia. So I want to do that. I haven't told them yet, but now I have, and I've surprised them a little bit, but we'll put it together for Thursday. Nevertheless, thank y'all so much. Thank you again.